Hello, and welcome to Advanced PD for the Caregiver, Planning and Coping. I'm Kara Iyengar, the social worker and Parkinson's Foundation Center of Excellence Coordinator here at the University of Iowa. Today, we're going to talk about three topics. The first is long-term planning, levels of care and how to pay for them, managing challenging behaviors and dementia, including strategies you can use, and self-care strategies, because your needs matter just as much as the person you're caring for. So to start off with, we're going to start talking about long-term planning. One point I really want to emphasize is that it is never too early to start thinking about the future, what you might need, and what your goals are for the future. So under the umbrella of long-term planning, there's three different topics that I want to talk about today. The first is about home and community-based programs. These are services and supports that can come to you in your home to help you remain independent and to stay at home for as long as possible, if that is your goal. The next thing we're going to talk about is assisted living and nursing homes. For people who can no longer stay at home even with supports, or who no longer want to remain at home and are interested in a facility placement, assisted living and nursing homes are another option. Finally, we'll talk a little bit about hospice and end-of-life care. So before we get too far into what these different levels of care are and what they mean and how to access them, I want to take a little bit of time to clarify the difference between Medicare and Medicaid. So Medicare is an insurance program that's meant for older adults and or people with disabilities. It can be supplemented with additional plans, such as Part D, or replaced by a Medicare replacement or Medicare Advantage plan. The cost for Medicare varies based on the plan chosen, and you apply for this through Social Security. One thing I recommend for everybody who has Medicare is to meet with a SHIP provider every year during open enrollment time. SHIP stands for Senior Health Insurance Information Program, and they can help people find the right Medicare program for them. Because it's a government program, they're not going to try to sell you anything. And because your Medicare plan can change from year to year, and because your health needs can change from year to year, it's good to sit down with someone who has some training to make sure that you're on the right plan for you. The other thing that I want to talk about today is Medicaid. So Medicaid is different than Medicare. Medicaid is meant for people with low income and low assets. There's a lot of different kinds of Medicaid, and so one thing I like to tell people is if you assume that you're not qualified for Medicaid, you might want to apply anyway, because depending on your situation and depending on what services you need, whether that's at home, regular health insurance, or facility Medicaid, you might qualify. So always better to just apply. In order to apply for Medicaid, you would go through the Department of Human Services, and it's generally free or low cost to be enrolled in Medicaid. So it's important to know this difference because the things that they cover varies. And so we'll talk about that a little bit more in the next slides here. So the first thing I want to talk about is home care versus home health care. A lot of people get these two things mixed up, and it's important to understand the difference because they're different things and they're covered in different ways. So home care is generally non-medical. This is things such as homemaking, bath aid, respite care. It's not typically covered by Medicare because it's not medical care. It can be short-term or it can be long-term, and it usually does not require a doctor's order. On the other side of things, home health care does include skilled medical care, and that would be things like physical therapy, occupational therapy, or nursing. If you are already getting a skilled care such as physical therapy, or if you're already getting nursing through home health care and you also need a bath aid, then the bath aid would be considered home health care. But if all you need is a bath aid, then it wouldn't be considered home health care, it would be considered home care. Home health care is typically covered by Medicare if criteria are met. The criteria basically are that you have a medical need for skilled services and that you're homebound. Home health care is typically meant to be short-term, It requires a doctor's order because it is considered medical care. Medicaid also covers home health care, but they do not have the homebound requirement. Another option for people who are living at home and want some extra supports and services is what's called the Elderly Waiver in Iowa. The Elderly Waiver is a program for older adults who meet the medical criteria to live in a nursing home and who also qualify for Medicaid. It provides funding for in-home services to help participants remain at home rather than moving into a nursing home. Participants are assigned a case manager who assists them with identifying needed in-home services, arranging for those services, and ensuring that the services continue to meet patients' needs. You can apply for the Elderly Waiver through DHS. So basically, the Elderly Waiver is a good option for people who, if they wanted to move into a nursing home, they could do that, but who want to stay at home and just need some extra supports to do that. It's nice for the participant because they get to remain at their own home, and it's nice for Medicaid as well because it does save money, typically to provide in-home services versus paying for a nursing home. So if you're staying at home and you're starting to struggle a little bit and thinking that you need some additional help or maybe some additional services at home to do that, how do you determine what services are available, what services you qualify for, how to pay for them, and if there's any additional help available in your community? The way to do that is through options counseling. Luckily, in our area, there are a lot of different ways to access options counseling. So in Iowa, we have the Lifelong Links program. The phone number is right there. You can just call that number for free and talk to someone about your needs, and they can kind of help point you in the right direction in terms of what's available in your area. Another option is through the Area Agencies on Aging. So the Area Agencies on Aging are a government entity, and their whole purpose is to keep older people in their homes for as long as possible by connecting people to resources and supports. In the Iowa City and Cedar Rapids area, our local Area Agency on Aging is Heritage, but every place in Iowa has an Area Agency on Aging, and actually every state has an Area Agency on Aging, although they might call it something different. Both Lifelong Links and Heritage Area Agency on Aging are free to talk to. And again, they're through the government, so they're not going to try to sell you anything or trick you in any way. That also holds true for the Johnson County Aging Specialist. If you live in Johnson County, we actually have a person who does option counseling, again, for free, to help connect with local resources in the Johnson County area. Finally, there are also private companies that do options counseling. Typically, these are free as well, but there might be a fee. You can find those online. And then finally, there's the Department of Human Services, which can help you determine if you're qualified for things like food stamps or Medicaid. So if you've been living at home and maybe you've gotten some services or maybe not, and you're starting to struggle and just think you'd like a little bit more help, or if you're just ready to take that next step and move just as a preemptive measure, assisted living can be a good option for a lot of people. Assisted living can mean a lot of different things. So it's typically for people who are mostly independent, but require some daily assistance. Again, it really varies from place to place, but it typically consists of a private apartment or some sort of private living area with support from staff. Sometimes they have a full kitchen, sometimes they have a small kitchen, sometimes they have no kitchen at all. It just sort of depends on the place. Services vary, but may include things such as meals, recreational activities, housekeeping, laundry, and limited nursing and aid support. So they might, for example, provide meals or a bath aid. They might provide laundry service, things like that. The services might be included as part of the rent. They might have you choose from options of packages of services. They might be a la carte or some combination there. So if you're interested in assisted living, that's a question you want to ask about what's included, what costs extra, things like that. Assisted living is not covered by Medicare because it's considered your home. So Medicare doesn't pay for people's homes or people's rent or mortgage or things like that. However, if you're getting home health services provided by the assisted living, so for example, if the assisted living is providing home physical therapy for you while you're living at the assisted living, Medicare might cover for that piece because that is considered home health care. With Medicaid, Medicaid might cover assisted living either partially or in full, depending on the situation and depending on the assisted living. However, if that's something that you feel like you may qualify for in the future, it's important to talk to the assisted living because not every assisted living accepts Medicaid. And some assisted livings require that you live at the facility for a certain amount of time, private pay, before they'll allow you to switch to Medicaid as the payer. So the next level up from assisted living is nursing home placement. Most people are familiar with what a nursing home is, but I want to talk a little bit about the two different types of nursing home placement so that you understand that. So the first one is skilled care. So skilled care in a nursing home requires a skilled need such as physical therapy, occupational therapy, or skilled nursing needs. It's meant to be short-term after an illness or injury, and the goal is to return home. It's covered by Medicare if requirements are met. So the requirements are typically a medical need, a doctor's order, and typically those 3 overnights in a hospital. There's some variation on that in certain circumstances, but those are kind of the basics. There's a limit on the number of days you can stay in a skilled nursing facility under skilled care with Medicare paying. And there's also a limit on the number of lifetime nights as well. So that's important to know. The main difference between skilled care and the next one, long-term care, is that skilled care is not your home. You're staying there for a short period of time. The goal is to get therapy, improve, and then go home. Long-term care is meant to be your home. This is where you live, it's your permanent address. What can happen sometimes is a person might enter a nursing home under skilled care with the goal of going home, but then due to whatever circumstances may be, they may transition later to long-term care. So just something to know there. Long-term care does not necessarily require a skilled need, but the person living there needs help with some of their ADLs. So that'd be things like bathing, dressing, grooming, things like that. It's meant to be long-term and it's not covered by Medicare. However, in Iowa, Medicaid might cover long-term care under facility Medicaid. So something to keep in mind there. And the last step there is palliative care versus hospice. So I'm going to focus on hospice because hospice is an end-of-life service that I think is really underutilized. But just because there's some confusion sometimes between hospice and palliative care, I want to go over that a little bit. So hospice is a type of palliative care. And I'm actually going to talk about hospice first. Hospice is for people who are at the end of life, typically the last 6 months of life. And actually, most people in hospice enter hospice during the last 2 weeks of life, which is really a shame because hospice can provide a lot of services such as a nurse, such as a bath aide, such as volunteers, sometimes things like pet therapy or massage therapy. They can provide support to the family after death, all sorts of really helpful things. And when you enter hospice 2 weeks before death, you really don't get an opportunity to benefit from those things. So if you are someone who thinks that you might qualify for hospice, it's better to get, for most people, on there earlier so you can get more benefit out of it than to get on later. Another thing to know about hospice is you can change your mind. If you enter into hospice and then decide it's not for you, then you can disenroll from hospice. And some people even graduate from hospice, which means that their condition improves so much that they no longer qualify. So those are things that can happen. Hospice is usually provided at a patient's home. So whether that's a house, whether that's a relative's home or a friend's home where you are staying, whether that's a nursing home. So if you're living in a nursing home, you can get hospice care, or even people who maybe live in a hotel or a homeless shelter or anything like that, you can get hospice care wherever you are. Hospice is typically covered by Medicare, Medicaid, and private insurance. There's typically no cost to hospice care. And hospice covers all the costs of any equipment, services, medications, anything like that related to your hospice diagnosis. So if your hospice diagnosis is for Parkinson's disease, hospice will cover the cost of all of your Parkinson's medications. If you need a wheelchair, they'll cover that. If you need a hospital bed, they'll cover that, etc. But if, for example, your hospice diagnosis is Parkinson's disease, but you also have diabetes, They'll cover the cost of your Parkinson's medications, but they'll not cover the cost of your diabetes medications because diabetes is not your hospice diagnosis. So that's just something to know. So again, hospice is a type of palliative care. Palliative care is not so much a service, but as a way of looking at things. So palliative care looks at the whole person, not just a specific disease, and they look at quality of life. So it can look a lot of different ways. It can provide a broad range of services, but it's meant to manage symptoms of a chronic disease, regardless of whether or not the disease is fatal and whether or not the patient is at the end of life. So you can enter palliative care at any time, regardless of whether or not you're anywhere close to the end of life. It can be provided at absolutely any time. It can be provided on an outpatient or inpatient basis. It's generally covered by Medicare, Medicaid, and private insurance, the same way they'd cover any other doctor's appointment, typically. However, it does not cover costs related to the palliative care diagnosis. So that's just something to keep in mind. So if you are on hospice, you're getting palliative care. If you're getting palliative care, you are not necessarily getting hospice care. So moving on to the next section here, we're going to talk a little bit about some challenging behaviors in dementia. One thing to note, just because you have Parkinson's disease does not mean you're going to get dementia. And just because you have dementia does not mean that you're going to have these behaviors. But I just want to talk about some of these just to provide some tips and strategies. If you take nothing else out of this next section, I hope you remember this, that behaviors are communication. So when a person with dementia is engaging in a behavior that's challenging or frustrating, sometimes it's helpful to keep in mind that they're not doing it to be frustrating or challenging. They're trying to communicate something. So just something to keep in mind there. So just sort of briefly, dementia is an umbrella term that includes Alzheimer's disease, which is most common, Lewy body dementia, many other types of dementia. 1 in 3 seniors dies with Alzheimer's disease or another form of dementia. So it's really common, but it's not a normal part of aging. Common challenging behaviors include wandering, agitation, hallucinations, repetition, suspicion, repetitive questions, or statements. So here are some communication strategies that are concrete when you're trying to communicate with someone who has dementia that might make your life a little bit easier. So the first is always introduce yourself, especially if you don't live with the patient. Just always introduce yourself. I know it can be sometimes really upsetting when a person with dementia might not remember your name or remember who you are, but it does make it easier for everyone to introduce yourself. Always approach from the front at eye level. So it's startling for anybody if you walk up behind them and start talking to them. Any of us would find that rude or startling, but people with dementia in particular struggle with that. So always make sure that you do that. And if possible, if they're in a chair, try to get down to their level, if that's at all possible for you. And then the next thing is to include them in the conversation. So I see this a lot in nursing homes, particularly at meal times, where staff will be talking to each other and maybe helping a resident eat, and they're talking to each other and ignoring the person with dementia. That's really a rude thing to do always, but especially with dementia, you want to include them in the conversation. So the next thing we want to talk about is using short, concrete sentences. People with dementia take longer to process things. And so if you come at them with a bunch of words, they're not going to be able to follow you necessarily. So keep it short, keep it concrete, avoid metaphors and slang and things like that, and then use a calm voice. Related to that, you want to leave plenty of time to think and respond. So one thing that is really hard in our society is silence. We don't like silence, but with a person with dementia, that is one thing that is helpful for you to do, is to get comfortable with silence in between statements. So instead of coming to a resident's room and saying, good morning, it's so beautiful outside, do you have to go to the bathroom? Do you need to use the restroom? I'm happy to take you to the restroom if you need to go. That's way too much. Don't rapid fire like that. Just one statement at a time. Good morning. and then give them a chance to respond, and then go on to the next statement. Do you need to use the restroom? And give them a chance to respond. If they still don't seem to understand the question that you're asking, then it's okay to rephrase it. But when you try to say something a bunch of different ways all in a row, that's just going to be confusing and frustrating. So again, one thing at a time, leave space, give them an opportunity to respond before trying to fill up that silence. Ask open-ended questions. Open-ended questions are great for conversing with anyone because it helps a conversation happen. So avoid questions with a correct answer. Meet them where they're at and don't try to correct or reorient them. So if they believe that, it's summertime and it's actually wintertime, there's no reason to argue with them about that. Just talk to them about their, favorite summer activities and what they like about summer and things like that. Now, the caveat is, of course, safety. If they believe it's summertime and they need to go outside and, they still need to wear a coat. But if you're inside and they're pointing out the window and talking about all the beautiful flowers out there and there's no flowers, just talk to them about flowers. It's okay. You don't need to explain to them that that's actually a concrete parking lot. That really doesn't help anybody. The main thing to know, though, is it's about the feelings, not the facts. So, if you're going into a room and you want to ask somebody, oh, it's nice to meet you, how many children do you have? That's not a great question. It's got a right answer. It puts pressure on them. A better question is, tell me about your kids, or what did you like about being a mother, or tell me about the people in these pictures. It doesn't have to be a matter of rattling off facts, because really the facts are not important. It's the feelings. So with that being said, we can talk a little bit about redirecting during challenging behaviors. So these behaviors can be really frustrating sometimes, particularly things like wandering, asking repetitive questions, saying they need to go somewhere, things like that. So some of the things you want to do off the bat is checking for basic needs. So that's safety, comfort. Do they have to use the bathroom? Are they hungry? Are they cold? Are they hot? Are they bored? Do they need touch? Do they need a hug? Things like that. Acknowledging the statement and, more importantly, the feeling. So if someone is saying, oh, I have to get to school, I have to get to school, you could say something, instead of saying, you're 80 years old, you don't have to go to school, and arguing with them, you could say, I can tell that school is really important to you, or who is your favorite teacher, or what is your favorite subject? Things like that, to acknowledge what they've said and have a conversation without necessarily arguing with them. Once you've done that and you've acknowledged them, you can redirect to another activity or a topic and kind of move away from that. And, sometimes it's okay to take a break or ask for help. So if that's what you need to do, then that's what you need to do. So what are some activities you can do in terms of redirection? Really, it's whatever you and the person find enjoyable, but some suggestions are reading, talking, sensory items, wheelchair rides, going outside is wonderful, art projects, looking at photos, funny videos. I've done a lot of just like cat videos, dog videos. Those are usually really popular. A hug, holding hands, going on a walk, and music. Music is really, really, really huge. So in this last bit of time, we'll just talk a little bit about self-care. It's important to know that your needs as a caregiver are just as important as your loved one's needs. As caregivers, sometimes we want to focus on the person we're caring for, and that's good and that's important. But you have to put your own oxygen mask on first. You have to take care of yourself. Otherwise, you're not going to be there for your loved one. So let's talk about a few different options for that. So the first one is formal respite care. So that's someone to come to your home and take care of your loved one so you can have a break, or sometimes your loved one can go there. That's things like private pay caregiving agencies, private pay caregivers, nursing homes and assisted living facilities sometimes do respite care where someone can go there for just a few days. Hospice pays for a certain amount of respite care, and adult daycare, which we'll talk about here next. So adult daycare is a really underutilized resource. It provides socialization, recreation, and supervision. Some centers have overnight programs. Most are open business hours. Some may provide basic medical care, such as giving medication or baths. It's usually not covered by Medicare, but some private insurances, the Veterans Administration, local grants, or Medicaid may cover all or part of the cost for some people. So if you're interested in adult daycare, it makes sense to meet with them and kind of talk about whether that might be an option for you and what the cost might be. Some people go 1 day a week. Some people go 1 day every other week. Some people go 5 days a week. It's just kind of what works for you and your family. The local adult daycare center in Iowa City is Pathways. Let's talk a little bit about asking for help. So this is hard, especially we're Midwesterners. We hate to ask for help, but Parkinson's disease is not the flu. It's not going to be over in, a week or two. It's a long haul. And so most people I've found have people in their lives who want to help and they don't know how. So reach out, ask family to come sit with your loved ones so you can take a break. Ask your friends to come over and have a cup of coffee with your loved one or play cards or take them out for a walk or, to a restaurant or something so that you can have a little break. Neighbors a lot of times want to help. Can they maybe rake your leaves? Can they take your dog on a walk? What are some things that they can do to help? A lot of people do have people who want to do that. And then community, church groups, social clubs, other organizations you're involved with. Are there people there who might be willing to help out? And then remember, your loved one needs socialization just like everyone else. Respite can come in the form of a social visit, coffee, playing cards, spending time with friends and family. Let them have a break from you. Let them socialize and be with people other than you, and you can, from a guilt-free standpoint, take a break. This is a marathon, not a sprint. Take breaks and ask for help. Thank you for listening to this presentation today. I look forward to talking to you more and answering your questions at our Q&A session. Have a good day.